Awesome. Welcome to MedTech live in Toronto. Mars next maybe, but we're here and it's super awesome. We got Wendy, we got Sonal. Tell us a little bit about yourself and go ahead.
Okay. Well, great to be here. Thank you so much for having us. This is my first MedTech Conference, so very excited to be here. I have been with Karl Storz for coming up on 4 years, about 20 years in healthcare, but newer to the world of minimally invasive surgery, and just exciting to be here and learn about so many of the different innovations and companies. Thanks for having us.
Hey, thanks, Mike. Sonal Matai. I've been with Karl Storz for the last 3 years. I've been in the MedTech industry for the last 15 years. And this is, I've been to the conference for many, many years, but coming back after 3 years full time because very excited.
So you guys are in the game. You've done this before. Tell us more about your company you're with.
Well, Karl Storz is coming up on our 80th anniversary, a pioneer in the field of minimally invasive surgery. Karl Storz is the name of our founder, and we have just under 9,000 employees all around the globe. Our headquarters are in Tuttlingen, Germany, and we're part of the United States team based out of Los Angeles.
Very, very much.
So you can check me on my math and history, but I'm pretty sure 80 years predates like software and AI and ML. So presumably you were selling a lot of non-computerized or non-connected surgical devices long before you were doing things with software and computers in them. But I'm having looked at your website, but I guess anyway, you've got more and more software coming in these days.
Very, very much.
So how has it changed your business?
I think in many ways, right? If I look at where we started off, we were a precision engineering company, leveraging our capabilities to actually muster cold light and create endoscopes, as well as the best surgical instruments probably that every faculty of medicine has seen. So how we've transformed the business as we go into more software-oriented solutions is across the whole value chain. It's not just our R&D teams have adopted and adapted to have more engineers doing software engineering work, data scientists, cloud engineers, AI engineers, but also across the whole spectrum, right? Our finance team is working, our sales teams are working. So we've actually kind of bring digitization to the entire value chain. One is on the innovation side, but also across the whole chain of what we do, etc. Our visualization, which is our strength, that we pride ourselves on our imaging, has also evolved. On how do we actually create better markers with our imaging, right? So that we can help our physicians drive better efficiency and better care for our patients. So a lot of it has been going there. So I'm very excited about what we've been doing.
You feel like you put, compared to 10 years ago, how much mind share do you put into digital overall today?
Wendy will tell you 100% of mine now. And a lot, a significant portion is going towards digital and solutions. And that's be also going. Right? If you look at this conference as well with AI and medically, if I look at machine learning enabled medical devices, that's our focus as we go into the future. So we want to lead in that as well. As we've led in surgical instruments and endoscopy, we want to lead the world also in these solutions to bring better technology to our surgeons so that they can do the best that they can.
Yeah, if I could build on that, I would say, we remain centered on the patient, centered on the provider. So as the needs of those groups and the opportunities for those groups continue to advance, that's where the mind share is, right? So if it's for providers and we're looking at AI solutions that are going to help with turnover optimization in the OR, if it's for patients, if it's going to help patients and their families know when are you entering the OR, when is the procedure completed, and give them that sort of comfort. If it's for the clinical teams in the OR with technologies that help them to be more collaborative and bring as many components of what is necessary to treat the patient into that procedure, that's where we're leaning in more and more to those digital solutions that can help.
Do you feel like you're more technical than you used to be? Or more computer savvy than you used to? Like, do you think about these things differently since you're now selling differently and selling different things?
Very much. I think the whole organization needs to upskill itself to be better at this so that we can outcompete and compete as well. One is outcompeting our competitors and compete as well so that we can deliver the best to our providers and patients, as Wendy pointed out.
Actually, it's funny you mentioned like all the sessions here that are focused in AI, and it's stuff that every year there's more and more. In fact, we've coined a new metric inspired by somebody who said, oh, gee, it was only 6 minutes to the first question on AI, which is MTAIQ, mean time to AI question.
I like it. I
So
like
love
it.
that is the official metric of this
Your
year.
mean time is your time is very short.
It is
Your-
short, but
your-
that's
your-
it's actually a lot of what we're interested in. All right, so Wendy, I'm gonna give you a little consumer metaphor since you run
Okay.
commercial in the U.S., correct?
Yes.
So you're responsible for business development and sales. I just got my first time in a long time brand new iPhone
Now
16
you're making us jealous,
Pro
Randy.
Max. Okay, I
Oh.
splurged. I went all in.
All right.
I'm really enjoying it, and they haven't even dropped the AI features in yet from Apple Intelligence. And I had no problem dropping. I don't even want to say the amount of money because it was a lot more than I should have. But if Apple came back to me and said another $150 for a really cool app on top of it, I'd be like, I don't know, I can get apps for free. You know, I paid for the hardware. Is it a challenge convincing providers to start to pay for software as opposed to hardware? It's less tangible. Is there a shift, or how do you guys deal with that?
I think that this is an evolution that we're going through. It really depends on what the software is. And I think to your point, the paradigm is shifting, the platform is shifting. Even going back to your iPhone, when Apple introduced the platform and they didn't really have any apps for it, and then people paid for apps, and then apps became free, but you pay for in-app opportunities. Or if you look at BMW, you know, now you can, whether or not you have your seat warmer enabled, it's entirely your choice, right? You're subscribing for the software to turn on to you know, warm your tush on a cold day. So I think it's going to depend on how important it is to driving the outcome that the provider is seeking and how differentiating that element is. But this is, providers for some time now have been asking for more and more subscription-based services. And so I do think that as that buying behavior becomes more of the norm and more of the expectation, you will see more of an appetite to enroll, unenroll in certain.
Interesting. So it's less paying for hardware versus software versus a purchase versus a subscription is sort of the mind shift.
I think we're going to continue to have multiple ways of acquiring. And I think that's also something that providers are very much looking for. Some might want to acquire at a portfolio level, some might want to acquire product by product, and some may want to subscribe. Our job is to be able to meet our customers and our providers where they are.
Got it. Got it. Actually, as you were talking about that and doing the evolution of like apps and in-app and stuff, I all of a sudden had a vision of like a surgery suite where somebody's using one of your mid-invasive things, and on the visualization, all of a sudden comes up like an ad for a new electric car.
I don't think that we'll be doing banner advertising in the OR.
No,
Yeah,
you will
Peter.
not
I
be
think
doing-
that would be ill-advised.
Yeah, well, I'd like to see the
Can't
person
keep
who gets
patients
that
at the
by the
center.
FDA,
We'll do that.
right?
Yeah.
Very much.
Randy,
Well, you could also offer it for the patient as well if it's if it's they're under light and twilight or awake.
We don't do that, but we do offer them videos they can watch on a tablet as they're getting ready for surgery.
Okay.
So again, patients at the center, providers at the center. So
Excellent, excellent. Okay, so 200 sessions, 4,000 attendees. Any golden nuggets you picked up? Interesting topics, sessions you still planning to go to in the next day? Like, well, what are you getting out of the conference?
I would say, you remember Alec Baldwin and Glenn Ross, always be closing, always be innovating. It's a new one. ABI, always be innovating.
Okay.
I think one of the best sessions I attended was these very young female founder and CEOs of startups that are focused on women's health. It's really exciting to see where innovations come in. We went to a fabulous session the other night with a lot of different thought leaders and industry leaders speaking about different paths to innovation, but it's just critical to growth. And I think it's really critical to ongoing patient care and the evolution of the industry as a whole.
Okay, so what I got is you're going to go back to the office in your first staff meeting. You're going to say, put down the coffee. Coffee is for innovators.
Exactly. Nicely
No,
done.
nice.
Well, I'm originally Chicago, and David Mann is Chicago, so you know that
Okay,
well.
there we
So,
go.
Very
well,
good.
thank you very much for coming out for
Thank
this
you
and
so
talking
much,
to
Randy.
us and sharing
Thank
with
Thank you
our
so
audience.
much. Yeah,
Thank you so
thanks.
much. Thanks so
Thank
much.
you.
Awesome. Thank you,
Awesome.
Mike. Thank you so
Awesome.
much.
Great.